Heavenly Gifts Child Healthcare platform. If you are seeing my face for the first time, my name is Ayanwola Boluwatife, and I talk about everything about the health of your child, everything that you need to know about raising a healthy baby and the baby. And if you are a returning subscriber, thank you so much. Thank you for believing in this channel. Thank you for tuning in. Thank you for supporting us. You know, we are just starting, and then you're watching our videos, you're liking, you're commenting, and then you subscribe. I do not take this stuff for granted. Believe me, I do not take this stuff for granted. Thank you so much, and welcome back once again. Yes. Continuation from where we stopped in our previous video. So today we are talking about tuberculosis. In the last video that I posted, we talked about patients whooping cough. We were able to talk about the symptoms of whooping cough and then the mode of contacting whooping cough. We talked about the possible treatments, and then we were able to emphasize that parents should make sure that they make sure that their children go for screening. When we talked about whooping cough, we talked about asthma, and then we did a video where we talked about teething that is associated with the symptoms of coughing. So could it be teething when our children is coughing? So if you are yet to see any of our video about this past 3 series of cough that we've talked about, please kindly check our previous videos on YouTube to learn more about cough and its symptoms. So today we are talking about tuberculosis. Tuberculosis is a bacterial infection caused by a bacteria called Mycobacterium tuberculosis. Tuberculosis primarily affects the lungs, but it can also spread to other parts of the body. Now we have different symptoms of tuberculosis. It has a short form called TB. Sometimes tuberculosis comes with blood. So when you see somebody, or you probably notice blood when your child is coughing, let's suspect TB. If your child is coughing and then blood is coming out. Another thing that you should also look out in tuberculosis is chest pain. Chest pain. If you think there are children, that particular pain, some of them might not be able to say it. And on this channel we are working with age brackets of children, and today our age bracket has extended to even up to the teenage age, like 20. You have a child, probably your nephew, your niece that stays with you in your house, and the person is complaining of chest pain, we can also suspect tuberculosis. Now, another thing that we need to look out for is when you have a child that is coughing for more than 2 weeks, and this particular cough is coming with weight loss. When this person has weight loss, the person is not looking healthy, we can start to suspect tuberculosis. When this particular cough is coming with so much temperature, I said it's a bacterial infection. So when a bacteria is in somebody's system, you are all going to agree with me on this channel that the person will be having fever. So when this cough is having fever at the same time with the chest pain, with the weight loss, and blood coming out when the person is coughing, it could be tuberculosis of the lungs. That particular type of tuberculosis is called pulmonary tuberculosis. Before we go further on this topic today, I would just like to tell us that tuberculosis is treatable. Yes, if it is detected early, if we can notice all these symptoms as early as possible and we can pick it up, we can start treating it. Tuberculosis will be treated properly and then it will go finally if it is detected early. So if you notice all the symptoms that I have mentioned earlier, please try as much as possible. In Nigeria, the treatment for tuberculosis is free. Clap for Nigerian government now. At least I am telling you for free on this channel today that in Nigeria, the treatment for tuberculosis is free. So now we move to extrapulmonary tuberculosis. If the tuberculosis was not detected early enough, it can extend to organs like the brain, the kidney, or even the spine. So, the first one I said pulmonary, the one that affects the only the lungs. But now imagine tuberculosis as it has extended to the brain of a child, the kidney, the spine. The person's organ is beginning to shut down gradually. So just like I said, if you notice all these symptoms early enough, please do your children good by carrying that child for tuberculosis examination, and I can tell you the child will be treated for free. Now, what are the causes and the modes of transmission of tuberculosis? Tuberculosis is an airborne disease, so it can spread through airborne droplets, coughing, and sneezing. And another thing that, just like I said for whooping cough, that some of these coughs are highly contagious and it can be contacted through an infected person. So I am always advising parents on this channel, immediately when you have a child that can understand, start telling them, avoid close contact with your friends. Do not share, do not use anybody's spoon in school. If by through the way Nigerian is, your parents was rushing when they were prepping you for school and they forgotten to put your spoon in your bag, kindly wash your hand properly and eat with your hand. It's better than using another person's spoon to eat in school. Sharing objects with an infected person can actually transmit tuberculosis to an innocent child. Close contact with an infected person will definitely transmit tuberculosis to an innocent person. So on this channel today, I am encouraging you to please, as an informed parent that you are, inform and educate your children properly. Let them know how to protect themselves against all these contagious coughs. Another thing that is that we really need to talk about tuberculosis is that there are some people that are at risk of contacting tuberculosis, and these people, one of them is the people that have HIV. 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 Anybody that is living with HIV, their immune system is already low already. So the person just needs to take care of his or herself and protect his or herself so that the person will not contact tuberculosis again. Another people that are also at risk of contacting tuberculosis, just like I said, is the people that are malnutritioned. Diabetic patients who are also at risk of contracting tuberculosis. Another set of people that I would say they are at high risk of contracting tuberculosis are the people that are living close to somebody that is infected, to an infected person. And how will you know? That is the reason why I said we need to be informed. If you can notice all these symptoms in somebody around you, the person is coughing out blood, the person is losing weight gradually or drastically, the person is losing weight, the person is complaining of chest pain, so please, you just need to protect yourself around that person. It might not be tuberculosis, this is internet, but then just be careful around. It might be tuberculosis and it might not be tuberculosis. In Nigeria, you don't know who is who, nobody's talking, so please just be guided. Now, prevention of tuberculosis: make sure you complete your vaccines, good hygiene, and then screening for high risk people. Just like I said, if you think or you are suspecting somebody around you that is coughing out blood, do screening. Just screen yourself, and then you just, after screening yourself, when you test positive, it's just apologies please, pardon me, when you test negative, you just know that at least I'm fine, than just living with the disease and the person will not know. Once again, I am pleased to inform you that tuberculosis is treatable. There is a treatment plan of multiple drugs. In tuberculosis, there is a treatment plan of 6 months to 9 months, and in Nigeria, just like I said, and I think in other parts of the country too, but I live in Nigeria, and I can say that in Nigeria, tuberculosis treatment is completely free. Thank you so much for joining us today. See you in our next video, and make sure you watch all our previous videos on cough, because this content is actually precept upon precept. One content is leading to another one. My name is Ayanwola Boluwatife, and I am your host on this channel. Thank you so much, and see you in our next video. Bye.